Sat down with a doctor who says AI could save doctors precious time and give them social resources so they can really focus on what they love doing, and that's treating patients. I want to bring in Dr. Omer Awan tonight. He's a professor at the University of Maryland School of Medicine and a healthcare and public health contributor to Forbes magazine. Dr. Awan, when we think of AI, we always think computers and techies. In medicine, does it have a use? What would the top one be? Would it be paperwork?
I think AI has an amazing opportunity to really revolutionize and transform medicine. And one of the main ways that it can do that is to decrease burnout. Burnout is rampant in medicine. People and doctors are burning out at alarming numbers, so AI can really be used to sort of decrease the amount of clerical work, paperwork, administrative tasks in a way that will allow physicians to do what they really love to do, and that's to take care of patients.
And then, of course, we get to errors. What about errors? Because the models we know do include problems. That's a big deal in a health summary. If your pharmacist is looking at it, your insurance company is getting this, you need accurate info.
Yeah, so I think AI has the opportunity to really make a big impact, but there needs to be physician oversight because there are errors. There are, erroneous, claims that, certain chatbots like ChatGPT make. So, there needs to be some regulation in terms of, how AI is being used, because physicians ultimately are the arbiters for how it's going to be used to impact patients, because, we're dealing with people, and that's a big deal. These are patients. These are, could be your mother, your father, a loved one, right? So we have to make sure that it's being used appropriately and it's not harming individuals. So that's where a physician comes in to really be the arbiter for how AI will actually be used effectively.
And I've been seeing coverage for years that dermatologists are going to be out of work because you look at someone's back and in the past year has a mold change, that AI is better at that. Or Dr. Awan, you're a radiologist, right? You're a diagnostic radiologist, that they can maybe be better at detecting a disease, or a clump or something than your eyeball. Are you afraid of being out of work?
Well, Chance, I've been hearing that for decades, and thankfully I still have a job. But, in all seriousness, I think, AI isn't going to replace physicians. It's going to augment the practice that we do. And it's going to make us more efficient because, what we're doing is that we're using AI to, make all of our operations more efficient. We're able to do more. I mean, I'm reading more studies in radiology than I ever have before, so I don't think that's going to change. 10 years down the road, we're going to see AI being used to help us make certain diagnoses, to help us ensure that we're not missing critical findings, and we'll be able to probably read more and to, affect patients in a more positive way.
We've been talking about the health side of this. How about the patient side? Because the doctors I love are the doctors who take time, look you in the eye, ask questions, they care. And if it feels like, I'm just getting this old generator report, that got spit out of a machine, how do you synthesize that?
Well, I think there's two sides of that, right, Chance? I think the bottom line is that AI will allow a physician to have more time talking to the patient. Just as you're saying, nowadays, physicians feel pressured talking to patients because they have to go through all this clerical work. They have to write up a note. But if AI is able to already generate that note for you, well, then that means that you get 5 or 10 more minutes with your doctor to talk, get questions answered, and things like that. So I think, there is a real positivity to it, but also there are some concerns, right? So I think a patient is obviously going to want to make sure that they get consented if any AI tools are being used. There's privacy issues. Where is this data going? Do they have the consent to use this data to, augment AI? So I think there are concerns from a patient perspective, but ultimately, I think it really will enhance the patient-doctor relationship by allowing more time, more care to occur.
Finally, Dr. Awan, do you think there's an opportunity to lower bills? Because healthcare costs are astronomical. I mean, this country, the costs of our healthcare are so much higher than in other countries,
Yeah, absolutely. I think it's a major problem here, and I think AI can. It remains to be seen if it actually will, but if it makes us more efficient, if we're able to do more with less time, if we're able to, as a radiologist, if I'm able to get through more studies in a shorter period of time, well, that's going to, increase revenue, hopefully decrease costs, hopefully allow for the patient experience to run smoother. Hopefully they'll spend less time in hospitals in situations where they won't need to be there, and hopefully, revenue and costs will decrease, hopefully, for our society.
Dr. Omer Awan, well, you thought the WebMD effect was strong before. Get those large language models in there. People are going to be coming in saying, I know what I need. Thank you so much.
My pleasure. Thanks for having me.